In 2022, a man named Justin from rural Tennessee had a heart attack. He survived. The ambulance ride was 12 miles. The hospital visit was 3 days. The surgery was successful. He went home to his family. Then the bill arrived, $319,000. Justin had insurance. After insurance paid its share, he still owed $58,000. He earns $47,000 a year. He has 2 children. He owns a modest home. And overnight, surviving a heart attack became the financial event that would define the rest of his life. Justin's story is not a horror story. It is not an exception. In America, it is Tuesday. The United States spends more on health care per person than any country on earth, nearly $13,000 per American per year. That is twice what Germany spends, 3 times what the United Kingdom spends, more than Japan, Canada, Australia, France, and every other wealthy nation combined in per capita terms. And yet, Americans are sicker. They live shorter lives. They have higher rates of diabetes, heart disease, and preventable death than almost every comparable country. So the question is not just, why is American healthcare so expensive? The question is, how did the richest country in human history build a healthcare system that is simultaneously the most expensive and one of the least effective in the developed world? The answer involves money, politics, and a system so complex that most Americans, including the ones paying for it, have no idea how it actually works. Here's what most people get wrong about American healthcare costs. They assume the problem is that Americans use too much healthcare. They assume Americans are sicker, older, or more demanding than people in other countries. The data tells a completely different story. Americans actually go to the doctor less often than people in most other developed countries. They have fewer hospital beds per capita. They see doctors fewer times per year than Germans, Japanese, or Canadians. The difference is not how much health care Americans use. The difference is what they pay for every single unit of it. An MRI that costs $400 in the United States costs $450 in France. A hip replacement that costs $40,000 in an American hospital costs $11,000 in Spain. The same brand name insulin that costs $350 per month in America costs $21 per month in Canada. Same manufacturer, same drug, same molecule. American healthcare isn't expensive because Americans are sicker. It's expensive because every single service, drug, device, and procedure costs dramatically more than it does anywhere else on Earth. The question is why? To understand why American healthcare costs what it does, you have to go back to World War II. During the war, the U.S. government imposed wage controls. Companies couldn't attract workers by paying more, so they began offering health insurance as a benefit instead. It was a workaround, and it worked. By the end of the war, employer-sponsored health insurance had become the dominant way Americans accessed medical care. Unlike in Europe, where government stepped in after the war to build national health systems, America never made that transition. The private insurance system was already entrenched. The political will to disrupt it never materialized. What emerged over the following decades was a uniquely American patchwork. Employer insurance for those with good jobs, Medicare for the elderly, Medicaid for the poorest, and nothing at all for everyone in between. Into this patchwork, several powerful industries grew up. And they grew up without the price controls, negotiation frameworks, and regulatory structures that govern healthcare. In every other wealthy country, the pharmaceutical industry in America can charge whatever the market will bear for a drug. There is no federal agency with the authority to negotiate drug prices the way governments in other countries do. The hospital industry operates largely as regional monopolies, consolidating over decades until a single health system controls all the hospitals in a given area and can set prices with no meaningful competition. The insurance industry sits between patients and providers, adding administrative complexity that consumes an estimated 34 cents of every healthcare dollar spent in America. These industries did not create this system by accident. They invested billions of dollars in lobbying to protect it. Consider the numbers that almost nobody talks about. The United States has more healthcare administrators per capita than any other country in the world, by a massive margin. A 2019 study in the New England Journal of Medicine found that administrative costs account for 34.2% of all U.S. healthcare spending. In Canada, the comparable figure is 12%. In the UK, it is 11%. That gap, 34% versus 12%, represents hundreds of billions of dollars every year spent not on doctors, not on nurses, not on medicine, but on the bureaucracy of billing, coding, claims processing, prior authorization, and insurance paperwork. Every doctor's office in America employs staff whose entire job is to navigate insurance paperwork. Every hospital has entire departments dedicated to billing. Every claim submitted goes through a process so complex that entire technology companies exist solely to help navigate it. And this administrative infrastructure exists largely because America has thousands of different insurance plans, each with different rules, different networks, different coverage requirements, and different billing codes. A doctor treating patients in Germany submits to one system. A doctor treating patients in America may deal with 50 different insurance plans, each with its own requirements. This complexity is not inevitable. It is the product of a system designed and continuously redesigned through lobbying to protect the interests of the industries that profit from it. Meet Sarah. She is 34 years old and lives in Phoenix, Arizona. She works as a freelance graphic designer. She does not have employer-sponsored insurance. She buys her own plan on the Affordable Care Act marketplace. Her premium is $487 per month. Her deductible is $6,000. This means she pays nearly $6,000 per year in premiums before her insurance pays a single dollar for most services. Last year, Sarah noticed a lump in her breast. She went to her doctor. She needed a mammogram, then a biopsy, then a follow-up specialist appointment. She was ultimately fine. The lump was benign. The bills for those 3 appointments totaled $4,200. Her insurance covered $800. She owed $3,400 on top of the $544 she had already paid in annual premiums. Sarah spent $9,244 on health care. In a year where nothing seriously wrong happened to her, she is not unusual. A 2023 survey by the Kaiser Family Foundation found that 38% of American adults reported skipping or delaying medical care in the past year because of cost. Among those without insurance, the figure was 69%. These are not people choosing not to engage with the healthcare system. These are people being priced out of it, and the consequences of delayed care are measurable. Conditions that are cheap to treat early become expensive emergencies. The system that is supposed to prevent serious illness instead prices people out until their illness becomes a crisis, at which point it costs far more to treat. The debate over American healthcare divides along ideological lines, but the underlying economics are not actually contested. Health economists across the political spectrum agree on the basic diagnosis. America pays more for the same things. The dispute is about why and what to do about it. On one side, researchers like David Blumenthal at the Commonwealth Fund argue that the fundamental problem is the absence of a unified system with negotiating power. When governments negotiate drug prices, as every other wealthy country does, they get dramatically lower prices. When a single payer negotiates hospital rates, as Medicare does for its beneficiaries, rates are significantly lower than what private insurers pay. The evidence, he argues, points clearly toward greater centralization of purchasing power. On the other side, economists like Scott Atlas at the Hoover Institution argue that the problem is not too little government involvement, but too much. That regulations, mandates, and restrictions on competition prevent the kind of market innovation that drives down prices in other industries. Remove the distortions, he argues, and competition will do what it does in every other sector. The problem with the free market argument for healthcare is that healthcare does not behave like other markets. When you need an appendectomy at 2 a.m., you do not shop around. When your child has a seizure, you do not compare prices before calling 911. Healthcare lacks the basic preconditions: informed consumers, meaningful choice, transparent prices that make markets function. And decades of experience with a market-based approach have produced the most expensive system in the world. The international evidence is clear. Every country that spends significantly less than America, while achieving better health outcomes, does so through some form of centralized price regulation, universal coverage, or both. There are several things most Americans believe about healthcare costs that simply are not accurate. The first is that America's high costs are explained by superior quality. The data does not support this. On virtually every population health measure, life expectancy, infant mortality, preventable death, management of chronic disease, the United States ranks below most comparable wealthy nations. Americans pay more and get less, on average, than people in countries with far cheaper systems. The second is that universal healthcare systems mean long wait times and rationing. Some countries do have longer waits for certain elective procedures. But Americans also wait. They just wait because they can't afford to